I think it was down the bottom, right, bottom,
there we go.
about the second from the right.
I think I've got it. It's coming up with a recording now, so we must be recording.
Okay.
Awesome.
All right. Okay, so I'll go through everything that's about your condition, but let me know if you have if you don't have an understanding about anything, or if you're not sure, just let me know at any stage. Stop me. So for the diagnosis, I found that you have what is called a left subacute trapezius strain. This means that the trapezius muscle that has a small strain. There are 3 grades that is used of muscle strains, and yours is a grade 1, which is the mildest one. The muscle strain is causing you pain in the area of the top of your left shoulder and the tension in your lower part of your neck on the left, as this is where the muscle attaches. Therefore, you are feeling some pain when you are turning your head to the left and using that arm. When the muscle cools down overnight, or when it is kept still for a while, is when it will be most painful. You have what's called upper cross syndrome. It is because you spend prolonged periods of time at a desk studying and your head's slightly forward more than normal. It's quite normal for students. It puts pressure on your neck muscles. The other thing that affects this area is your scoliosis. This also would be putting pressure on those neck muscles. For treatment recommendations and a schedule, we look at clinical guidelines. Studies have provided that, clinical guideline studies have proved that by working on your trapezius muscle in your shoulder over a 5-week duration, that good outcome measures can be achieved. Treatment would be 4 treatments over 5 weeks, concentrating on working on your injured trapezius muscle, this muscle here, and the surrounding muscles, these muscles right around here, just to make sure they're free and they don't affect those type of areas. Seeing a massage therapist this week and again in 2 weeks later will also help to relax the trapezius muscle and the muscles around it as well. I'll give you some exercise to do daily over the next 5 weeks that will aid the recovery as well. So care type of things that we're going to look at is the type of treatments I'll use will be muscle-related release treatments like trigger points, cross friction. Trigger points are when I push on one area of muscle, hold it for 20 or 30 seconds. You might feel a sharp little pain at the start. It should ease after a while. Sometimes it can radiate down the arm. As you feel the pain release, it's a sign that the muscle's also relaxing. Another type of treatment I can use is cross friction. It's where I will do some massage across the muscle instead of along the muscle for 20 to 30 seconds to relax the muscle. These are 2 examples of the type of muscle release treatments that can be done. So there are some risks and side effects I need to tell you about. We're working on the muscles, they're nowhere near as bad. So they're quite low risk compared with other things. So you would have better chance of winning a lottery than something like this happening. Working on your muscles could in some cases spread things like cancers, viruses, skin conditions, blood conditions. As we have discussed in your medical history when you first come to see me, there is no signs of these conditions. After treatment, each time you may have some pain around the muscles in the left shoulder, which should settle in the subsequent hours. You may get headaches after treatment as well. Drinking plenty of fluids should help to relax this. If you decide not to get treatment for your shoulder issues, the pain will release over the next few weeks, but as the problem is still there, it will come back more regularly. And there will be weakness in that shoulder as well. And over time, the chances are will start getting progressively worse. You can go to your local GP. The GP will give you anti-inflammatories and medications to relieve the pain. These are not treating the symptom. They're just, these are treating the symptom, but not treating the cause. So the prognosis is good with treatment involving chiropractic and massage. As the massage pain is mild and has recently happened, it should recover in the next 5 weeks with the goal of no pain being achieved from week 2 to 4. Normally I would say 4 weeks to recover, but with your scoliosis affecting their recovery, I would say 5 just to give us an extra week. Muscles recover faster than ligaments and will have no ligament damage. And with no ligament damage, it speeds up the recovery process. I would recommend continued care after the shoulder heals to maintain your body's optimum performance. Monthly visits will maintain this. So, do you have any questions regarding that?
No, I don't think so. That sounds good.
Good. So I'll just, some of the type of muscle questions that I do get, like questions like, do you have any questions about how will the shoulder be strong as it was? Things like that. There's no reason why the shoulder won't recover as strong as it was, if not stronger, because over time these muscles can fatigue when there's something going on there and make them weaker. So the shoulder should be a lot stronger after these treatments. Other types of questions with muscles can be, what happens if the shoulder does not recover? And as I said before, with the clinical studies, the research suggests that there shouldn't be any problems with the recovery. A muscle strain is a very mild injury compared with a lot of other things, and it should recover well over time. So with all that done, I just have to get you to sign the form. I'll get you to read through it and just make sure you understand. Any questions, just ask me. Thank you.
Awesome. Thank you.